this example. It's kind of like an analogy. You love roller coasters, but I hate them. Okay, so we're gonna, for this example, so we go and you're gonna go and you're gonna have a great time on that roller coaster. You're gonna be throwing your arms up in the air, having a great time. It's gonna be fun. What kind of hormones and chemicals do you think your body's going to be producing at that time? All these good hormones that are going to have a positive effect on your body. And then you take the opposite example of me. Let's say that I don't like that roller coaster. I have a bad time and I'm all stressed out during it. What hormones is my body producing, right? Stress hormones. Those stress hormones actually act on the musculature, and they can pull and move bones out of their normal position because of the change of the musculature. And then that has an effect on the nerves, and then it's kind of like a repeating cycle. Right? Stress affects a lot, right? It affects the whole body's health. I hear this question kind of a lot, like, is it safe to crack my own knuckles? Is it safe to what, like all these different things? And the answer is yes, if you do it the right way. Okay. So if I was going to take an example of, and that noise you're hearing is what's called a cavitation. First, pretty much means that, like, let's say you take a joint and you open it, there's a little bubble that forms inside of the joint. And then when the joint comes back together, let's say I open it like I do this. Let's see if I can get one. No, I've already done it. So, so what happens is that the little bubble will be formed in there, and then when the joints come back together, when the bones come back together, that bubble will pop, and that's the noise that you hear. How to do it safely? Do it. Let's say that you're feeling some tension in your hand, right? So I would, instead of pushing into the joint and kind of compressing the joint space and hearing a pop that way, I would open up the joint and then you'd hear a pop. So that would be a safer way to do that. There's nothing wrong with hearing those pops and clicks. It's just part of the bones moving. But what I don't agree with is doing it in a way that's forceful or jerky in a way. If you do it nice and slow and you hear a pop, that's fine. Okay. When you take your neck and you do this kind of thing, that's not good. You could injure the tissues in that area. Happens there is the actual patella gets moved outside of its normal joint space. And that's an interesting joint because it's kind of free floating within a tendon that goes on top of the femur and the tibia and the fibula. So it moves outside of its normal position. And along with that, you can get injuries to ligaments. You could have arteries damaged. You could have nerve damage as well. So understanding that the body is a dynamic chain, right? So you got the feet, then the knees, then the hips, and then the spine that goes up, and then so you got your neck, right? So understanding that it all plays together. So the way that we take care of, athletes in our office is making sure that their full body is in the proper placement, right? Not just the knee. A lot of knee issues aren't necessarily knee issues themselves. Let's say that the foot is out of alignment or the foot's not moving properly, causing tension on some of the musculature and causing things to be more rotated than normal and predisposing it to an injury. Same thing with the hips. The hips can be out of alignment, causing more pressure on the same things, right? The muscles and the tendons, and then the knee is more prone to injury at that place. Rest, ice, compression, elevation. You guys might have heard this, but maybe something that they don't know is that more of the research nowadays tells you to actually don't rest it, move it, keep the as long as it's not a catastrophic injury like a dislocation, right? You want to actually get that moving as much as possible, because that movement gets blood flow to the tissues and keeps it healing. Obviously, be persistent with your care, what type of care you're doing, whether it be chiropractic or physical therapy or whatever it is. Make sure that you're persistent with your care, and just know that your body is meant to heal, right? It's, if you cut your arm, your body knows how to actually heal that, right? So it'll send the right proper nutrients and blood flow and tissue all to that area to be able to heal it. So know that your body is made to heal. So just have confidence and faith that your body will continue to get better. Scoliosis is if you're looking at a spine from front to back, the spine should just be straight up and down. Scoliosis happens when you have curvatures in the spine, okay? So the spine goes laterally, left or right. That can happen. How does scoliosis happen? It could be a congenital issue. In other words, you were born with it. Or it could be a functional issue that comes on over time. Let's say that we talked about a hip misalignment. Your hip can actually misalign and actually can functionally create a curvature in your spine. Same, and also with that is, let's say that looking at someone from the side, you should be able to have a curve here. If somebody starts to straighten out their curvature, what ends up happening is your body will start to compensate for that issue. So you'll actually start to do a lateral lean one way or the other to be able to take pressure and absorb the impact of gravity. Some people, if you take somebody, let's say that their spine is bent like this, I would have them bend away from that curvature to see if the actual spine opens up or not. Okay. And oftentimes what you'll find is that it can open up. It can be corrected, sometimes fully, sometimes partially. It just depends upon the person. And then when we get into actually correcting it, there's specific type of adjustments that we would do using specific tables to be able to adjust that curvature. So obviously balance out the hips, balance out the feet, and then the adjustments go laterally through the spine. So let's say that a person has a curvature like this, and then that's where the spine is if you're looking at them from front to back. The adjustment would be right here on this side to be able to start to slowly open up that part of the spine and straighten it out. I always like to stretch every single day. So I start my day, I get out of bed, and I'll make sure I stretch my entire body from head to toe every single day. That takes me about 15 to 20 minutes. And that goes a long way in preventing injury. Get adjusted on a regular basis. That's what I do, making sure that your spine is in alignment. That's on the physical aspect. Chemical, making sure you're eating properly and avoiding toxins, right? So you're making sure that you're eating a nice balanced diet, whether it be paleo or ketogenic for small periods of time, Mediterranean diet. All those diets are really good. Vegan diet, making sure that you're eating good, healthy foods, clean foods that are organic. You're not poisoning your body with toxic chemicals every single day, right? And then emotional, mitigating your stress. So, making sure you're practicing some type of gratitude every single day. Help, whether it's some type of spiritual connection, meditation, prayer, something like that, some type of practice, getting into nature regularly. All these things can go a long way and making sure you're mitigating stress, finding something that you love to do every single day, and doing that. So that's physical, chemical, and emotional, kind of like a really broad category, but those are the general ideas that you'd want to do to make sure that your body's healthy. You go into the game with a healthy body, right? So if you look at a guy like LeBron James, the guy's gone for 15 to something like 18, 20 years. I don't know how long he's been in the game, but he's been doing it for a long 17 years. He's been doing it for a long time, and he's had minimal injuries, right? But did you also know the guy spends $1 million a year on just taking care of his body? So it's not just like a thing that you do right before the game, right? That that makes you less prone to injury. It's all the time that you take on an everyday basis leading up towards the game that makes the biggest difference, right? So, if LeBron James just, that day decided he's going to want to start stretching that day to make sure his spine's going to be healthy, it's got to be consistency, taking care of the body on a regular basis to avoid those kinds of injuries. But if you're looking at like just on that day, making sure you do what's called dynamic stretches, dynamic warm-ups, right? So you're actually moving the spine and moving all the different musculatures, particularly the ones that you're going to be using functionally. But what you would do is you're not doing it like, you're not holding it for 15 to 20 seconds or a minute. You're just kind of, just moving the spine, moving the muscles to be able to keep them loose, get the blood flow into the tissues, to be able to make sure that there's plenty of blood in the tissue so it won't overstretch or create tears or ligamentous tears, things like that. put there, every single joint in your body, you want to take through its full range of motion every day, right? So, you know, what you start with the neck and work your way down. So in the neck, you know, I'm just doing side to side, rotations, up and down, all those different kind of motions, holding those on each level for about 4 seconds. Then you work your way down into the arms, do every single motion that that joint can do. So, you know, let's say your hands, making sure you're getting the wrist flexors both ways, each individual finger. You know, I literally take every joint through every motion that you can do every single day. That will help increase the blood flow into the tissues and make sure that the ligaments are not prone to injury.